Now we usually start, or I usually start off this hour just to remind us all about what's happening in the world. It's a weird time. We really want to record our solidarity for all of those who are providing care for people with COVID-19, and also all the people providing care, keeping everything going, and the key workers, and just about everyone. And I think last week I decided everybody practically was a key worker, because everyone has a small contribution or a large contribution to keeping things going, keeping our lives more comfortable than they could be without. But just a few moments to think about some of the people we've lost, and so also some of the people who are unwell at the moment. And COVID seems to be one of the most horrible things, in that some people are ending up not feeling well for a long time, and we just wish them well over this period of time, and hope anyone who's poorly has a speedy and good recovery. Okay, and we'll have a little highlights from this week's news. And of course, at the weekend, it was the 72nd NHS birthday. Now, I love a birthday. My birthdays never last one day. So let's make it an NHS birthday like our own birthdays. And this should last not just a day, not just a week, but maybe the whole year. And so I've decided this is at least a birthday week. Now, next week, we have our festival online. We were going to be in Leicester, and of course Leicester's experiencing a lockdown at the moment. So just to say to Leicester, we're with you. We would be there with you. We're going to be with you in spirit, so that we'll be there next week online. So, and just to remind people, July is Strep B Awareness Month, and just to let you know that the GBS charity have just announced a new Facebook called Due In Group for mums expecting their baby in October and December this year. And these are a really good way for women to talk and share their experiences and find more about Strep B. So there will be information on the Facebook after this, so you can get your information. Now, I had it last week. I started a trend with the best tweet of the week. I'm a bit of an avid tweeter, and it's difficult to choose this week. There were some really good ones, but one I liked was from Cochrane UK, which always have loads of really good, strong evidence-based material. And this was about the diagnosis of COVID-19, very much drawn out from several studies, so really useful. So look out for that. And of course, this morning, it's been very much in the news, is the Independent Medicines and Medical Devices Safety Review, which published its report, First Do No Harm. And that was reviewing hormone pregnancy testing, sodium valproate, and pelvic meshes, which have caused a lot of damage to women. Very groundbreaking work. And this was led by Baroness Cumberledge, who's very closely allied with our maternity services. And so, again, there's a link to that report on the resources page for you. So you might want to get that. In fact, there's lots of resources from everything from, now this is new languages, isn't it, over the last few weeks, donning and doffing your PPE equipment, and there's lots of clips of things that will be useful, lots of reading from previous presentations. So that resources sheet will be available to you all. So we're really getting to the meat of the programme tonight. We're going to be looking at COVID-19 and maternity service with a very much a BAME or BAME perspective, whichever you prefer. So we know there are stark inequalities in the maternity health outcomes of Black, Asian and minority ethnic women. One of the stunning things of Black women being 5 times more likely to die as a result of complications in their pregnancy than white women. Astounding, and we need to really address that. Asian women are 2 times more likely to die. And I think over the last few weeks, we've become very aware that also our health workers and midwives, our nurses are also, the BAME midwives and healthcare workers are more at risk also. And we need to think about that when we're working together, quite apart from the other inequalities that exist that I'm sure are going to be emerging from the discussion tonight. So I'm really so pleased that we have our 2 lovely speakers, very glamorous and very knowledgeable about their field. So we're going to start off with Mala.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.